back in, and this time I'd like to talk a little bit about coronavirus and how it's impacting our practice and how it could impact our practice and why it's really kind of so important for us to take this very, very seriously. So apologize, I was just outside with the kids. This is Sunday, it's the middle of March, and we're really kind of in week 3 of this coronavirus outbreak and week 2 of the coronavirus pandemic. Last week, when the government had really kind of started taking this seriously, we really saw a rush into our clinics by people. And I know my clinic was very busy, a lot of patients coming in, very few no-shows. And I think the reason is that a lot of people really wanted to get everything taken care of before things may shut down. In Italy and throughout Europe, they're starting to close things off because this has really gotten bad there. And I feel like this is the week that we may see things get bad here. So as a retina specialist, we take coronavirus, like all healthcare specialists, really, really seriously. The biggest reason is because our patients are the most vulnerable. When you look at the patients we provide care for, I would say 70 to 80% of those patients are in the 65 and older age range. You know, we do a lot of age-related macular degeneration, and those are going to be the patients that are going to be hit hardest by this virus. And so we want to take extra precaution to make sure that patients don't get this, because it can be really devastating, especially the patients who are much older and who are in nursing homes. Likewise, we also take care of a lot of diabetic patients, and so those are also a very vulnerable, immune-compromised type of patient that may well do very poorly with coronavirus. So we also want to make sure that our diabetic patients don't get this, because it too can be devastating for them. They tend to be some really medically fragile patients. At the same time, we have to counter that proactiveness and that attempt to try and do everything to prevent patients from getting this while still delivering care. So what we do for the most part is during the clinic days, which about 4 out of our 5 days a week we're seeing patients in clinic, is we're monitoring patients and treating them with anti-VEGF therapy for either their age-related macular degeneration or their diabetic retinopathy. And one of the important factors for these treatments is that patients need to be able to continually get their injections. Many of these patients will get worse if they don't get their injection either every month, every 2 months, or every 10 to 12 weeks. And so therefore we have to try and do the best to continue to deliver this care that these patients need to prevent vision loss, while at the same time safeguarding them from other patients, from anyone in the healthcare profession that may be infected and whatnot. And although that doesn't seem to be a factor right now, I predict that as time goes by, that may become much more of a factor as this pandemic starts to really spread. So if you're a patient and you're watching this and you receive anti-VEGF injections, I want to assure you that we are doing everything we possibly can to create a safe environment for you. From screening our staff in a variety of ways to ourselves, screening patients as they come in, trying to create an environment where we have a lot of social spacing so that people aren't close to other people that could be infectious. Keep in mind that although people who aren't yet infectious can still spread this virus, they are the most likely to spread the virus when they first start having symptoms. So if someone's coughing or sneezing around you, I would distance yourself from that person. But we try to avoid that, and if we see a patient show up with a cough or a fever or a history of not feeling well, flu-like symptoms, we're going to send them out and get them tested, and then we'll bring them back when we know that they don't have coronavirus. I know many of you may be afraid to come in to an environment where you're going to be around other patients that could be carriers of this and could infect you. If you are really worried, it's important to call and basically postpone your appointment. I worry that this may go on for months, And therefore you want to ask if it's okay if you spread out those injections. For most people, going a week or two longer without receiving your injection shouldn't cause any permanent vision loss. If you're someone who has very aggressive leaking blood vessels and you know you need injections every month or so, then it might be wise to check with us and make sure that you're not going to lose anything from that standpoint. If you're someone that we're spreading the shots out and maybe you're going every 8, 9, or 10 weeks, typically missing a week or two shouldn't be a big deal. If you're someone that's coming in for like an annual appointment, a yearly appointment, or a 6-month appointment, just push that off. If we're only seeing you every 6 months to a year and your vision's stable, please just postpone that for another 3 or 4 months. That's not going to be a problem. But what we want to do is we want to create a very safe environment for our patients. We want to reassure our patients that we're going to be here for you, that we're still going to be doing emergency retinal detachment procedures, and that we're still going to be seeing new patients as long as the government doesn't insist that we shut down. And we're going to be doing it in a very safe and effective way. I'll be back with any kind of updates as far as how we do things here in the United States. I've reached out to a couple of my colleagues in Italy to try and find out how they're impacted. They're a couple of weeks ahead on this. And stay safe and be cautious. Our patients, our older patients, are some of the sweetest, most beautiful people, and we don't want to lose any single one of them. Thank you for watching, and stay tuned for more updates.